Hi, I'm Dr. Jarrett Pullen and I'm here with the CSU Podiatry Service, and today we're going to talk about podiatry radiographs. So podiatry radiographs are a slightly different spin on regular foot radiographs, as we're looking at more what information that will be handy for the farrier. So we're looking at in between the coffin bone and the shoe, and that way we have a better idea of some of the measurements so we can objectively help the horse. A lot of the questions I get are when is the best time to take radiographs to help the farrier? And I would say the best time is while the farrier's there. So right at the end of the shoeing cycle, it'd be great to have radiographs to show exactly where we're starting. That way the farrier knows how much foot there is and what the angles are with objective numbers. And then from there, the farrier can do their job, and then to take post radiographs after the job's done. That way we know exactly how we're leaving the horse, and if the horse preferred that setup or if there was something that we could improve, we know exactly where we left off, so that way we can improve it for the next time. The next question I often get is, how often should I get radiographs? Or I don't need radiographs if my horse is sound, do I? And I'd say, in my world, it's fantastic when we have baselines. Say all of a sudden your horse is lame, you bring it in, and now we have the radiographs from what we have today, but we don't know where the horse started. So in my practice, I prefer if the horses get at least minimal 2 sets of radiographs a year, so about every 6 months, so we have good solid baselines to start with. So from here, we're going to demonstrate some of the things that I look for when I'm taking radiographs. So for one, I like to look at the horse, make sure he has a nice natural stance. I try to do the horse unsedated, however, every now and then we'll have to sedate him in order to get him to stand still enough. The next is we got to make sure the feet are clean. That way we're not getting any artifacts of rocks, stones, and dirt. So I'll just take a nice wire brush and get the feet nice and clean. We'll pick them out, making sure that the frog is clean and the edge of the shoe, so we know exactly where the foot begins and where it ends. Another thing to look at is to have a nice even flat surface. That way we're not dealing with any undulations of the ground. Sometimes at a barn it can be difficult to find, but if you can find just a small area that's as flat as can be, we'll usually work with that. The next is looking at the radiograph blocks we use. We want 2 blocks of equal height, so the horse is always standing nice and square and even. I prefer these blocks. They're specifically sized for the generator that we use. They have metal lines in them, that way we can always see the exact ground line. So I take a look at the natural stance of the horse and I try to place the block underneath. If the horse is toed out, I want the blocks toed out. As I said, we want it on nice even feet. We don't want one on a block and the other off the block. We want the feet nice and square. One thing we have to take into account is some magnification. We'll have magnification due to the center of the foot is what we're going to take our measurements off of, so I'll use a calibration stick. And all it is a piece of metal of known size. So you can see in this example that the hairlines, the crosshairs of the generator are exactly just above the shoe. And that way we'll know exactly what we're looking at. Many foot rads are taken at a higher beam, and those are very handy for diagnosing coffin joint issues, but for farrier radiographs, we prefer this low beam. Another thing to add is I usually take my 2 views of each foot. I can usually do this all by myself. And in this case, I'm taking a higher beam shot because I'm looking at the joint spacing. When I want to take a look at the dorsal wall, I'll use a marker. I prefer barium paste, as it'll come out and it'll go directly to the hoof wall, in which case I just put a stripe down. And by following all these rules, And this sequence, every single time, we get objective radiographs that we can look at in series. So I know that if this horse comes back in 6 weeks or in 3 years, as long as I use the exact same methods, I can take measurements and compare them directly against each other. Now to take a look at the radiographs I took so I can point out some of the features. If you look, you can see where the barium paste clearly defines the hoof wall, so we're able to take measurements off that. Often you'll get feet that have irregular walls and the barium paste follows the contour a lot better than just putting a regular typical metal marker on. This shot was a low beam, so you can tell my focal point was shot in between the shoe and the bone, so I'm able to clearly measure my sole depth as well as my palmar angle. Those measurements are very handy to look at from one shoeing to the next, whether it's the next shoeing or the next day or even 6 months or 6 years down the road to see what's changed. Another measurement I like to look at is how broken back the horse is, and if I take a P1, P3 measurement, and that allows me to tell if I'm standing the horse up or lowering it down. A lot of these measurements I use, that way I can objectively measure from one appointment to the next. That helps me form a solid treatment plan to see what we have to do to help this particular horse.